So am I live? I think I am live. And hello and welcome all of my dear friend in this session and of discussion based on our updates from COVID-19. And 1 second. Okay, so welcome back and good evening to all of my dear friend. So let's continue the discussion. And as you all must be aware that this is a new test designed by CSIR and IGIB along with Tata Institute. And this Feluda test is of course a replacement for RT-PCR. It takes 45 minutes to detect a special type of protein that is known as FN Cas9. Okay, this is the name of the protein. And why it is known as Feluda? Because it is FN Cas9 is the name of the protein which it detects. E is for editor. L is for limited. Okay. So it is editor limited. What? Any question? No, it's okay. I started. Uniform detection assay. So editor limited uniform detection assay. And what is this FN stand for? FN is actually name of the bacteria Francisella novicidia. This Francisella novicidia bacteria, and so that's why we have FN. This bacteria releases this Cas9 protein. Okay, this Cas9 protein, it binds with genome of COVID-19 RNA, of course COVID-19 bacilli, and therefore by using CRISPR technology we can detect whether you have COVID-19 infection or not. So it is a special type of protein which help us in detection of COVID-19 infection. Okay, so it also detect, in a way it detects antigen and our presence of COVID-19. So what is this CRISPR technology? It is based on CRISPR technology. What is that? This CRISPR technology stand for the clustered. Okay, so it is clustered regularly interspaced short palindromic repeat. Okay, we all know that in the genetic material some short segments are repeated at a fixed interval. So this CRISPR technology, which is a method of gene editing, okay, this CRISPR is gene editing methodology, we will talk about it, which help us in detecting those repetitive sequence. And those repetitive sequences which are detected by this CRISPR technology, cluster regularly interspaced short palindromic repeat. So this technology help us in detecting whether FNCase9 protein is getting attached in the blood of the patient with COVID-19 or not. So if COVID-19 is present, that will attach with this protein, and then this protein sequence can be detected with CRISPR technology, which help us in finding short palindromic repeat within the genetic material. So how to remember the short forms, and because they can ask the short form, it's easy because this Feluda test is actually based on because it was developed by CSIR. What is CSIR? It is Council of Scientific and Industrial Research. So this council, along with IGIB, what is IGIB? This is Institute of Genomics and Integrated Biology. So these two institutes, along with Tata, Institute of Genomics and Integrated Biology and Institute of and CSIR, they collaborated and they devised this test. And the name of this test is based on a detective character which is from Satyajit Ray movies. Okay, because this is just a scene from the movie, Hannah, and this movie was based on two detective characters which were named as Feluda. Just like we have Sherlock Holmes, and there was a vaccine on the name of Sherlock. So this CSIR, they thought that we should also have a vaccine based on the same concept. So that is why we have the name Feluda. And how to remember the name Feluda? It's very simple. This movie was a detective movie. So in the Feluda, it is the editor, mostly the director is the editor, and it's the Satyajit Ray movie, and so it's the Editor Limited Uniform Detection Assay. So in Feluda, we are doing the detective work, we are detecting it, and this is Editor Limited Uniform Detection Assay. So I hope you can remember it with this, that there is a detection and there is an editor in it, okay, and it is based on this character from Satyajit Ray movie. So what is the advantage of Feluda test? First advantage is that the RT-PCR which we use, this RT-PCR, we all know that it is reverse transcriptase polymerase chain reaction. So in this reverse transcriptase PCR thing, first we have to convert RNA to DNA, and need to be converted to DNA. And when it is converted to DNA, with the help of this enzyme, because reverse transcriptase is the enzyme which convert it, we all know. So it takes a lot of time. Average time which it takes is 1.5 hour. So average time of test is 1.5 hour. Second thing is, when we are doing RT-PCR, we store 96 samples and then we perform the test. So storing that 96 samples takes a lot of time, and if you do not store 96 sample and do the test, then the test will be much more expensive. So we generally wait to store 96 sample. That's why in some places the result come on the next day or the day after that, because they take time to collect it and then process it. So that's why, because it need to be converted, it's long time taken. Now second test, which is of course by India, that is Feluda. As I said, it takes 45 minutes. But this Feluda, as it was based on Cas9 protein, Cas9 protein, but Feluda test is not the only type of test. Like, India is not the pioneer in this field. Before India, Oxford have also used similar test, which is based on Cas12 and Cas13 protein based test are used in USA since May. Since May 2020, we are already using this American people are already applying this test, Cas12 and Cas13 protein based test. Okay, so it's not a new concept, but because the protein is new, Cas9 new protein, so they have named it according to that. Now it takes 45 minutes and it is protein based. The third type of test which we have is the RAT test, which is mostly done nowadays in India, that is rapid antigen detection test. Okay, Now, what is the difference between these three tests? First thing is that rapid antigen detection test, it detects RNA sequence. So here we need not to convert RNA to DNA, we can detect directly. So that's why it takes 30 minutes. And that is the test which we are usually doing at most of the hospitals and most of the places. There is one problem and one difference, main difference between RAT and RT-PCR. The difference is that in RAT test, the sensitivity is 50%. So if sensitivity is 50%, it means there is high chances of false negative. Okay. Why there is high chances of false negatives? Sensitivity is 50%. What is sensitivity? Sensitivity simply means ability to include. Okay. Ability to include. The more you can include, the more sensitive the test is. If you go to the exact definition, it is ability to include true positive. Okay. How many people who have disease are positive on the test? That is sensitivity. Okay. Sensitivity means people who have disease, how many of them are positive? So 50% sensitivity means that if 100 patients of COVID-19 are there, then 50 will be found positive. And the remaining 50, they will become the false negative. Okay. Out of 100 patients, this RAT test can only detect 50 patients. That's what sensitivity 50% means, that it can detect only 50% cases. So the remaining 50 will be said negative, and they will be said that you don't have COVID-19, but they actually have the disease. That's why they are false negative. False negative means actually someone have disease, but you call him still negative. And false negative is also known as miss out. And now it will make it more clear. Miss out. Those who have the disease but still negative, who are missed out. Okay. So, and there is also one formula between sensitivity and false positive rate. That sensitivity, false negative rate. That sensitivity is equal to like 1 minus specificity. This is equal to false positive rate. Okay. And 1 minus sensitivity, this is equal to false negative rate. So if you have low sensitivity, there is high chance of false negative. Okay. These are the two formula which they can ask also in the exam. False negative rate simply means false negative by false negative plus true positive. That means false negative by out of total disease. And false positive rate means false positive by false positive plus true negative. Okay, these are the two formula for false negative rate and false positive rate. So what I was saying is that for this RAT test, the sensitivity is 50%. Okay, and specificity is 99%. If you go to RT-PCR, RT-PCR have sensitivity of 67% roughly. So it is better than RAT, but it also have 33% false negative rate. And this 67% sensitivity which are here is not so high, but the specificity is 99%. So RAT and RT-PCR are almost same here. Now when you compare these two with the Feluda test, which of course is based on Cas9 protein, है ना? Remember that Cas9 protein, FN, Francisella nocardia, and then no, you remember the name of the bacteria, that was Francisella novicidia, है ना, which produce this Cas9 protein. So Feluda test have sensitivity of around not around 96%, and the specificity is 98%. So you can see that Feluda test has more sensitivity. That means Feluda test will not give false negative. If Feluda test is applied, then the government will get more cases, because the sensitivity is 96%. So the miss out rate is only 4. Miss out is only 4%. 4% will be missed out. So you will get more cases. Okay. In RT-PCR, they said that we get slightly less cases than actual present, than reality. And in rat test, we get very less cases, 50% cases than actual present. Okay. So if a government is doing Feluda test, they will get more cases. That's why many government are applying rat test more. Recently, Supreme Court has said that UP and Delhi should apply less rat test and more RT-PCR, because rat test give only 50% cases than actual present. It miss out many people. But if you are positive on rat, because it does not mean that you are wrongly positive. If you are positive on rat, specificity is 99%. It means the chance that you are wrongly positive is hardly 1 to 2%. Okay. So suppose some of you are detected by rapid test, because this is the rapid antigen test which we are doing. Okay. For example, recently my younger sister was found positive on this rapid antigen test. So should we do the RT-PCR on this patient or not? If someone is card positive, should we do RT-PCR or not? So the answer is no. Because if someone is positive on rat, the specificity is 90%. It means that person is 99%, there is higher chance that he will or she will actually have the disease. So now there is no use of doing RT-PCR. But suppose if a patient have upper symptoms of COVID-19, okay? Suppose someone has having loss of smell, loss of taste, headache, loose stool, pneumonia like difficulty in breathing, cough and other symptoms. So if they have if a patient have symptoms of COVID-19 and suppose he went for the rat test, rapid antigen test, and the rat test give positive. If rat test give positive, there is no need of doing RT-PCR, because RT-PCR and rat test both are 99% specific. So if they are giving positive, then they can miss out some people. But if they are giving negative, it is sure that like specificity is 99%. That means the ability to detect true negative is 99%. So it's a diagnostic test. And for a diagnostic test or a confirmatory test, specificity is more important. Okay. So there is no need. But suppose if the symptom rat test say that someone is negative for COVID-19, okay, rat test came negative for COVID-19. In that case, if the patient have symptom, you should do RT-PCR. If patient have symptom, you can do RT-PCR. So the rat test which we are applying right now can be replaced by Feluda test also in future. So if we are doing rat test mostly in any hospital, entry point and any place, and it is giving positive result, we need not to do RT-PCR. But if it is giving negative result and the patient have symptom, you should go for RT-PCR. Okay. Now the last test which we do is of course antibody detection test. That is the fourth test, which is antibody detection test. And what are the three tests? One is RAT, one is RT-PCR, one is Feluda. Last is antibody detection test. And what is the purpose of antibody detection test? It detects previous infection in asymptomatic patients. Because antibody develops when the patient start fighting against the disease. So it is not to detect, it is not used to detect recent infection. It is not used to detect recent infection. Okay, it detects past infection. Because in the past, if there was an infection, then only antibody will be synthesized. So this was the question in recent AIMS exam also, that what is the purpose of antigen detection test? It detects previous infection in asymptomatic patient. Now, one more difference is there between RT-PCR and RAT test. In RAT test, we take only sample from nasopharyngeal area. So only nasopharyngeal swab is taken. But in case of RT-PCR, we take both nasopharyngeal and oropharyngeal swab. So because you are taking it from two sides, now the chance to miss it is less. That's why in RT-PCR the sensitivity is roughly around 67%, and in RAT test the sensitivity is 50%, because here you are taking it only from one area, nasopharyngeal. So there is more chance to miss out 50% people. But in RT-PCR there is only 33% chance to miss out those who have COVID-19. Okay. And of course in antibody detection test we take blood sample of patient. But in RAT test or in RT-PCR or in Feluda test, because we have to detect something from the antigen, and antigen are deposited in nasopharyngeal, oropharyngeal area. So in the remaining three tests we take nasopharyngeal or both naso and oropharyngeal swab, but in antibody we take only blood. So let's see what are the question. Good evening sir. Recent changes in TB. Of course we will discuss recent changes. Any other thing from your side? No. Okay, so I will discuss the recent changes in TB program now, because it has been asked. And if you have any doubt here from these four test panel, if you have any question from this part, you can let me know. And there please remember the full form of Feluda, that is FN, the name of the bacilli, and then Cas9 is the protein, and it is editor limited uniform detection assay, and it is based on CRISPR technology. So what I was telling about CRISPR is that it is gene editing. It is used for gene editing. And what you do by gene editing? To treat or prevent a spread of disease. Okay, if you know that due to this virus this genome is affected, then with the help of CRISPR technology you can detect that genome in the patient and you can confirm that the patient has corona or not, like we are doing here. CRISPR technology help us to find that genome which is producing a specific protein, and then we can either correct that genome or we can detect that genome like we are doing in COVID-19. If we know the specific genome, either we can do the test like here in case of Feluda we are doing the test, or we can treat the illness also, and CRISPR is also used to treat the disease sometime. So it is gene editing methodology. Okay, it is used for gene editing. Okay, type 1 and type 2 error, of course I will discuss type 1 and type 2 error. after discussing recent TB changes. Okay, and I hope you have seen the image carefully, है ना? They are saying, to tell you the truth, his mind seems to be elsewhere. Okay, Satyajit Ray, and this is a scene from it. It is Utpal Dutt, the hero in that movie. Okay, and the reaction is quite weird, but anyway. Now let's move ahead and read first about the changes in TB program. So in the TB program, we all know that first thing is now we have TB elimination program, because the target of India in our 2017 to 2025 strategic plan, the target of India was to eliminate TB by 2025. Because the sustainable development goal which we have, it say eliminate TB by 2030. So India is saying that we will eliminate TB 5 years before the global target, 5 years before what the SDG are saying, we will eliminate it. Okay, so if we want to eliminate it, first of all we should change the name from RNTCP. We will change the name to National TB Elimination Program. Okay, and the aim is to eliminate TB by 2025. Now in the new TB program, what are the recent changes? First thing is that all the patient with 4 symptom complex. What are the 4 symptom complex? One is cough for more than 2 weeks. We all know that, more than or equal to 2 weeks. Then there is fever, night sweat, and significant loss of weight. Okay, significant loss of weight. So if a patient of COVID-19 came to you, corona patient, positive patient came to you, you will ask about these 4 things: cough for more than or equal to 2 weeks, fever, and significant loss of weight. Now when will you call significant weight loss? Significant loss weight means more than or equal to 10% body weight loss in less than 3 months. So if my weight is 90 kg and I lost 10 kg in next 3 months without doing exercise, without other cause, then you can suspect that I have a significant weight loss. Okay, so if these 4 symptom complex are present, if present in COVID patient or patient with, or any patient like in COVID patient or like or any other patient, what we do then, CB-NAT test is done. Okay, nowadays we are not collecting sputum for detecting TB. All cases of TB, they will either have these 4 symptoms, okay, or they will have symptoms resembling to COVID-19. The COVID-19 and TB, their symptoms is resembling. So CB-NAT test is done in all new TB cases. We do CB-NAT test. I'm not saying that every COVID-19 patient has to go through CB-NAT. No. If COVID-19 patient has these 4 symptom complex, then COVID-19 patient will also go through CB-NAT. And if any other patient, any new patient have these 4 symptom complex, they will underwent through CB-NAT test. Now, this is one point which the government is doing. They are not doing ZN smear preferably now they are doing CB-NAT directly. Because one thing is that we do not want to get into contact with this thing like ZN smear. If it is done, then the sensitivity is also not so high, the specificity is not so high as compared to CB-NAT. Plus one more reason is that just like CB-NAT or Gene Expert, we have one more test in India that is known as TrueNet TB test. This CB-NAT or Gene Expert or TrueNet TB test, these both are based on polymerase chain reaction technique, PCR technique. Okay, you take one small chain of DNA of bacilli and you amplify that. Okay, both are based on PCR technique. This TrueNat test is developed by India. There is a private organization known as MolBio Private Limited that has developed it in India. So the advantage of TrueNat TB test is that, first of all, TrueNat TB test give result in half hour. Okay, just like CBNat. CBNat also give result in half hour to 1 hour, maximum 1 hour. But the main advantage of CBNat and TrueNat TB test is that both tests do not only detect the TB bacilli. Both of these tests, they also detect rifampicin resistance. Okay, both tests also detect rifampicin resistance. Okay, so government is saying do not go for acid fast bacilli. If you have 4 symptom complex, directly go for CBNat or TrueNat test, because TrueNat test is less costly, of course. Now, there is 2 other tests which we can use in place of ZN smear. One is fluorescent microscopy and other is LAMP. What is LAMP? LAMP is loop mediated amplification technique. So, and in fluorescent microscopy we use a fluorescent dye, and that fluorescent dye auramine O get attached with the bacilli and help us in telling about the bacilli without missing it, because now the bacilli is glowing, so we will not miss it under the microscope, under the fluorescent microscope. So LAMP and fluorescent microscope, they do not detect rifampicin resistant. Rifampicin resistance is detected only by CBNat or TrueNat, but they only detect TB bacilli. Okay, and these 2 tests, CBNat, both tests also detect rifampicin resistance along with TB bacilli. Along with TB bacteria, CBNat and TrueNat are better because they also detect rifampicin resistant. Now, LAMP is very low cost. So WHO is saying that in place of ZN smear, we can use LAMP if you don't have the money for CBNat test. Okay, but India devised a new test, TrueNat. So in future, ZN smear will be replaced by TrueNat in India and by LAMP in African country, and it is probable. So this is some of the simple things which has already been done, but WHO has also changed the guideline for the treatment of MDR TB, which if you want I can tell. It is very simple thing that in the previous time when we used to give TB drug for new cases with no resistance, how we used to give it? We used to give it by simple HRZE. We all know the full form, isoniazid rifampicin pyrazinamide ethambutol. HRZE, it is for 2 months, and 2 months is better to call it 8 week. And then we used to give HR only for 4 months, and 4 months means 16 week. So in the earlier time we used to call this phase as the intensive phase, and this phase as the continuation phase. Okay, there is a question from Dr. Ankur that is ZN staining is done in pediatric population. We can do ZN staining in pediatric population, but that is very problematic to do, because One thing, they do not produce enough sputum, and in a child you cannot, it is not easy to collect sputum. And even if we get the sputum in ZN smear, for ZN smear to be positive, we need 10,000 bacilli per ml of sputum. For ZN smear to be positive, more than or equal to 10,000 bacilli per ml of sputum. So suppose the child do not have 10,000 bacilli per ml, or suppose the child did not produce enough amount of sputum, then ZN smear will be more difficult to do. And in this time of COVID-19, we always prefer to do CB-NAT directly if possible. Especially if it is a child, we should do CB-NAT, because from CB-NAT there is a less chance of missing out TB cases, and there is more chance that we will get the TB cases accurately. And at the same time, in just one test we will also detect rifampicin resistance. So first thing, it will not let us miss out the pediatric case. Second thing, it will tell us directly whether we have to treat according to this regime, new cases with no resistance, or we have to treat according to rifampicin resistance regime. And so it does both the thing. That's why we do not try to do ZN smear in the first step if CB-NAT is available. Otherwise, we'd go for ZN smear. Okay. Please explain ROC curve. Okay. I already noted down your doubt. One was type 1 and type 2 error. Other was ROC curve. I will explain both of it. I would love to do that. And these are good concept. Very good question. Okay. So now, first focus here and try to remember the treatment of TB according to the new WHO schedule right now. Okay. Try to remember it right now. This is simple. We know that. Now, second type of patient are those which are isoniazid resistance. So if there is only isoniazid resistance, then we cannot give the H. So for 6 months, we give RZE, and along with that, we add levofloxacin, LFO, levofloxacin. This is what we give directly for 6 months. Not intensive and continuation. They are directly given for 6 months. But in India and in many developing countries, we have HRJD, and we all know that HRJD or HR, they are given as single tablet per day. So usually we have HRJD which is available because it is given in the national regime. So if someone develop isoniazid resistance, if RJD is not available, if RZE tablet not available, because usually it is not available, then we can also give the HRJD tablet, okay, plus levofloxacin. Okay, we try to give RJD, but if it is not available, we can also give it HRJD tablet along with levofloxacin for isoniazid resistance. Now the third and last type is those which are either rifampicin resistance or MDR-TB. Okay. So what is the definition of MDR-TB? We all know, at least resistance to both isoniazid and rifampicin, at least resistance to both of this. So in case of rifampicin resistance or MDR-TB, we can treat in 3 ways, 1 out of 3 ways. First is known as 6 to 9 month BPAL regime. Okay, it's a very simple regime, very easy to give. Here in BPAL regime, what we do is first 6 months we give bedaquiline. So there are 3 ways for rifampicin resistance treatment. One is 6 to 9 month BPAL regime, in which there will bedaquiline pretomanid and levofloxacin along with and levofloxacin, no along with. Okay, so in this BPAL is for pretomanid, bedaquiline and levofloxacin. First 6 months we give bedaquiline, and after 6 months we do a test. If that test is positive, then pretomanid and levofloxacin is given for 9 months, otherwise it is given for only 6 months. So pretomanid and levofloxacin for 6 to 9 months. Okay, first 6 months we give bedaquiline. Bedaquiline cannot be given for more than 6 months, it is given only for 6 months. But for pretomanid and levofloxacin, a test is done, of course CBNAT test we do. Okay, CBNAT test is done. Test is done at 6 months. In place of doing CBNAT test, it is much better to do drug sensitivity testing, which not only test for rifampicin resistance, but it also detect for other resistance. Okay, so we do a drug sensitivity testing test, DST, drug sensitivity testing test is done at 6 months. Now at 6 months, if the patient is still positive on DST, then we give 9 month pretomanid and linezolid, and if it is negative, then we give only 6 month pretomanid and linezolid. Okay, so this is known as BPAL regime for 6 to 9 months, but BPAL regime is only given under strict supervision. It is only given in research because we are not still aware of all the adverse side effect of this newer drug. So this is BPAL regime. Now second is shorter MDR regime. Shorter MDR is given for 9 to 11 months, and last is longer MDR. Longer MDR is given for 12 to 18 months. Now in all of these, please remember, first 6 months we definitely give bedaquiline. So bedaquiline is given for every MDR or rifampicin resistance TB. Okay, either it is shorter regime, longer regime or BPAL regime. First 6 months bedaquiline. Now in the longer regime, along with bedaquiline, first 6 months bedaquiline plus we give levofloxacin plus linezolid sorry, let me write it correctly, linezolid, and along with linezolid we give cycloserine. Okay, so sorry, bedaquiline is for first 6 months, and in the first 6 months we give along with bedaquiline these 3 drugs, levofloxacin, linezolid, cycloserine. So this all 4 drugs are given for first 6 months. After 6 months we do a test, and again if the test is positive, then we give the remaining 3 drugs except bedaquiline. What are the remaining 3 drugs? Levofloxacin, linezolid, cycloserine. This 3 drugs we continue to give for next 6 to 12 months. Okay, so the same, there are 4 drugs out of which you stop bedaquiline at 6 months and you continue giving the other 3 drugs for 6 to 12 months depending on result of the test. Now, so these are the 2 regimes. One was BPAL regime, one was longer MDR. The shorter MDR is something which is very big because there are 7 drugs in it. And I don't know whether they will ask it or not, but these are the recent changes. So let me just quickly try to make it easy for you to remember and try to make it. It is shorter MDR regime, 9 to 11 months. So of course we will give bedaquiline in the first 6 months. And we also do a testing, and in the first 4 to 6 months, okay, we all know bedaquiline for 6 months. Then for 4 to 6 months we give, what are the drugs that we give? One is levofloxacin, then other is cycloserine, other is clofazimine, okay, clofazimine, and the last one is ethionamide. Between levofloxacin, clofazimine, we have pyrazinamide, ethambutol, high dose isoniazid, HH we write it, high dose isoniazid, and the last is ethionamide. So it is given for first 4 to 6 months. LFO means of course levofloxacin, Z is the pyrazinamide, E is ethambutol, the same which we are giving in treatment of non-drug resistance TB. HH is high dose isoniazid. And main new entry in the gang is ETO. What is that ETO? Ethionamide. So it is 7 drugs are total here. You can see 1, 2, 3, 4, 5, 6, 7 drugs are given in the first 4 to 6 months, but it is easy to remember. How? If you remember the mnemonic LCE, LCE, E for ethionamide, L for levofloxacin, C for clofazimine, and the remaining 3 drugs are the same which we give for treatment of normal TB. HRJD we give. Here we have rifampicin resistance, so we cannot give rifampicin, but we give the remaining 3 drugs HZE. R is not given, but the 3 we can remember. 3 are LCE, and of course bedaquiline is given for every MDR regime or rifampicin resistance regime in the first 6 months. So bedaquiline plus LCE plus the 3 older HEZ. These are given in first 4 to 6 months. Then after this, in the next 5 months, we give the first 4 drugs: levofloxacin, clofazimine, pyrazinamide, ethambutol. These 4 drugs we give. In the next 5 months, we give levofloxacin, clofazimine, pyrazinamide, and ethambutol. Okay, and ethambutol. So this E is ethambutol. It is not ethionamide, and here it is ethambutol, not ethionamide. So this is in the first 4 to 6 months, and then it is in the next 5 months. This is the shorter MDR regime of 9 to 11 months, because if you add 4 plus 5, 9, 6 plus 5 will be 11. So these are the can we use amikacin and ceftriaxone? Yes, we can use, Dr. Sivam, you are correct. We can use amikacin also, not ceftriaxone, but we can use amikacin. If there is resistance to any of these drug in this category, then we can change it with amikacin, suppose, but it is not in the normal regular regime. But if resistance is found, we can change to amikacin and we can give it. Okay. Okay. Just I was doing the revision for the new TB regime, so I came here, and I know it is PSM class, okay, but this is some new changes in the WHO guidelines, so we are dealing with it. Now let's come back and let's discuss the other questions which you have. One question was about type 1 and type 2 error, and the next question was ROC curve. So type 1 error is the probability of doing alpha error. It is the same thing. And type 1 error means how many times you are saying probability of saying probability of proving or saying non-significant result as significant. This is type 1 error, non-significant result as significant. Okay, you can simply remember it by understanding that type 1 error means when you are giving false positive. Okay, or you can also remember it by understanding that it is acting over smartly. Okay, what does it mean? When someone is, let's say you are in the second year of MBBS and you are not reading that much, but when your father called you, you said that yes, I am reading a lot, I sometimes sleep in the library also, है So what you are doing is you are trying to act over smartly. You are trying to say that in reality you are doing non-significant study. In reality, in second year, suppose you are not studying, which like most of us, we do not study in second year mostly, but you are saying that you are studying a lot, and you are saying that you are doing significant hard work, when in reality your work is actually not so significant. You are not giving that much time of education. Okay, and it is same as saying false positive. Okay, one example which I also give in the class for it is like, you might have heard it, that suppose some doctor came and said that I am pregnant. So he is giving a false positive report because, believe it, I am not pregnant and this is just fat. So here the doctor is giving false positive, and therefore he is conducting type 1 error because he is saying a non-significant result as significant for pregnancy. Okay, so this is type 1 error. One more way of understanding type 1 error is ability to reject, or it is probability, or probability is much better to write ability. Probability to reject null hypothesis even when it is correct. Okay, what is null hypothesis? Null hypothesis means the new drug is same as the old drug. There is nothing significant here. Okay, so alpha error or type 1 error means when the null hypothesis is correct. For example, in my case, I am not pregnant, so null hypothesis is correct. There is nothing significant. But the doctor is forcefully rejecting the null hypothesis. He is saying that no, there is something significant. So he is rejecting null hypothesis because null hypothesis says that I am not pregnant. Doctor says, and he gave false positive result. He rejected null hypothesis even when null hypothesis is correct. So this is the definition of alpha error. And why this, remembering this definition is important, because the meaning of alpha error is almost similar to the meaning of p-value. Their meaning is same. That's why they sometimes say that p-value also means acting over smartly. What is p-value? If you write down in one clear definition, p-value simply means probability of getting a wrong result. What are the chances of getting a wrong result, or probability of getting a significant result by chance? Okay, whatever come by chance can be wrong also, and a chance is something which is totally unpredictable. So by chance also means by mistake. So what are the chances of saying that your drug is useful by mistake. Suppose p-value came to be 0.05. It means 5% chance of saying that new drug or new study is significant, new drug is better by mistake. Okay, by mistake or by chance, how many times you are saying that your drug or your study is significant when in reality it is not significant. That means if p-value is 0.05, you can simply means that there is 5% mistake in the study. 5% mistake, 5% wrong result is there. So we want to keep the mistake minimum, that's why we want to keep p-value less than 0.05. Okay, and what is alpha error? Alpha error means acting over smartly. Probability of saying a result as significant when it is not significant. That means probability of giving false positive. Anna? So false positive means saying non-significant as significant. Non-significant as significant. So you can understand that both type 1 error and p-value, both alpha error and p-value have same meaning. Alpha error means false positive, so it is also mistake. False positive is what? False positive is mistake. This is also a mistake. So alpha error also means mistake, p-value also means mistake. So that's why their meaning is same. That's why sometime in the exam they ask the question that which of the following is correct for p-value, and this line, probability of rejecting null hypothesis even when it is correct for both p-value and alpha error. For both of it, this statement is correct. Okay, so this is type 1 error, and let me give you a common example. Suppose Baba Ramdev said that coronil drug is very powerful, it can protect all of the Indian from corona. So what Baba Ramdev is doing is he is acting over smartly. He is trying to prove that his drug is very useful when in reality it is not useful. He is saying that coronil is falsely positive. That means it is useful when in reality it is not useful. So he is doing mistake, he is saying wrong result. So that is alpha error. Whenever you try to say that your study, your drug is better, when in reality it is not better, it is type 1 error. Okay. Now, when we go to type 2 error, any question for box and whisker and skewness we will discuss. Yes, I taught tuberculosis drug because it was in the new WHO regime they had some changes. So I just discussed that, and I discussed the changes in the guidelines that now we are trying to do CB-NAT test in all those patients of COVID-19 also who have 4 symptom complex. Okay, and then after discussing the some of the TB test and WHO regime, now we are discussing alpha beta error. So I just discussed the changes, of course, and thank you Rajsri. Thank you for appreciating my effort. Let's read type 2 error now, and if you have any doubt, any question, I will solve all the question which you post. Even if it is very late, I will try to solve all the questions, so feel free to post your question. I will come back and solve it. Type 2 error is just the opposite of type 1. It is acting foolishly. Or alpha error was false positive and type 2 error is false negative. False negative. What does it mean? Type 2 error means? Type 2 error means suppose a new drug or a new research is useful, but the scientist said it is not useful. So he is acting foolishly and he is doing type 2 error. Okay? When a new drug or study is significant. Significant means what? Useful, है ना? So if a new drug or study is significant, but researcher said it is not significant, okay, he commits beta error, and beta error is type 2 error, okay. Let's take an example. Right now we discussed that the rat test has 50% sensitivity, okay. So 50% sensitivity means it will detect 50 patient out of 100, and it will set the remaining 50 to be negative even if they have corona, है ना? 50% sensitivity means 50% false negative rate, because we discussed that 1 minus sensitivity is false negative rate. In ROC curve, next thing I am going to discuss is ROC curve. We will make it more clear why sensitivity and this false negative rate are related. So false negative simply means that patient have corona but came negative, okay. So this is false negative. You have something but still you are negative. So just like that, in beta error, a new drug or study is useful, but the scientist was so foolish that he said that it is not significant, it is not useful, okay. So he is acting foolishly, he is giving negative report even when it is useful. So that is type 2 error. Let me give you an example. Example of type 1 error was the coronal drug, and suppose someone said that it will prevent everyone. He is doing type 1 error. Now let's take example of type 2 error. Okay, suppose let's say you are preparing very well, and still you say to yourself that my preparation is not sufficient. I am forgetting the things which I have remembered 2 months back or something like that. You are saying it to your mind again and again. So you also remember the 90% thing and you forget only 10% thing. But if our brain forget 10%, we always accuse it. Oof, bhul gaya na, you forget it. But we do not appreciate our brain for 90% thing which it remember. Okay. So what you are doing here is, you are saying that you have weak memory and you are abusing your brain that it is forgetting. Even when your brain is significant, even when your brain is useful and it is remembering 90% thing, but you are not focusing on that 90% thing which is remember, you are not appreciating your brain and you are just criticizing it. So in a way you are saying that your brain is not significant even when it is significant. Okay. So that is type 2 error. We do it all the day, we underestimate ourselves. Let's take one more example. Suppose I said that doing exercise will increase IQ. Of course we all know that. But I did a research and I said exercise do not increase IQ. It means I am wrong. Exercise is useful in increasing IQ. But suppose I said that exercise is not useful. So I am acting foolishly, I am doing type 2 error. Okay. So that is type 2. Type 2 means false negative, type 2 means acting foolishly. And we all know that there are two terms. One is confidence of study, which is equal to 1 minus alpha error. And other is power of study, which is equal to 1 minus beta error. So if you want to increase the confidence of study means what? How much you can rely on the result. How much we can rely on result. And that is equal to 1 minus alpha error. So alpha error is how much false you said and acting over smartly. You are saying wrong thing as correct. Okay. Saying wrong or insignificant thing as significant, or wrong finding, wrong or insignificant as significant. Okay, so how much confidence do you have on your friend? It depends on how much less lie your friends say. What is alpha error? Alpha error is a lie when you are acting over smartly, when you are saying wrong thing. So confidence is inversely proportional to lie. If a friend is saying more lie, he is doing more alpha error, and then of course the confidence will be low, because the lie is more, so the confidence will be low. The same thing is with any study. If alpha error increases, confidence decreases. And beta error means you are underestimating yourself. So if you underestimate more, your power of course decreases. Stop. And if you underestimate more, your power decreases. Okay, because beta error means underestimating the result, or you can say it is acting foolishly. So the more foolishly you act, the less powerful you become. Okay, the same thing is with the study also. Shukriya, Dr. Prasad. Let's cohort case control cross sectional. Bikram is want to understand. Okay, we will come to that. Nested case control and mixed cohort, we will discuss that also. And before that, let's come to the ROC curve, which was asked before. If you have any question, confusion regarding alpha error, p-value, or anything from this area, please feel free to ask it. Anna, I will discuss it right now. Okay. But till that time, till you ask any question from this topic, let's discuss ROC curve. Because in ROC curve, we have two things. One is we draw sensitivity here. And we all know that sensitivity is the ability to find true positive. So sensitivity is also known as true positive rate. Okay. Here we have false positive rate. Okay. What is false positive rate? We just discussed it is equal to 1 minus specificity. Why is it so? What is the reason why false positive rate is equal to 1 minus specificity? And why sensitivity is true positive rate? Because we know the formula of, first let's come to the sensitivity. We all know that the formula of sensitivity is true positive by total disease. Okay. So true positive by total disease. Total disease can also be written as total real positive who are actually positive, because if you are disease, you should be positive on test. So I can write true positive by total disease or total real positive. That's why it is known as true positive rate, because true positive out of total positive. So it is true positive rate. And false positive rate means what? False positive rate is also known as false alarm rate. When you said that there is a thief, but there is no thief, and your car, suppose your car alarm or your dog start barking in the night without any thief, that is false positive, false alarm rate. So why it is 1 minus specificity? Because according to the definitions, false positive rate is equal to false positive divided by total non-disease. Okay. What is total non-disease means? Total non-disease means it is false positive plus true negative. If you remember the 2 by 2 table, in the 2 by 2 table, in this part where we write non-disease, we have two terms, false positive here, true negative here. So when we form false positive rate, it is false positive divided by combined false positive plus true negative. Okay, it is in the non-disease part. So this is false positive rate formula. And if you write 1 minus specificity, you can write it as 1 minus true negative by true negative plus false positive. Okay. And if you will solve it, on solving it, true negative plus false positive minus true negative by true negative plus false positive. Okay, I will discuss coefficient of determination and coefficient of regression. Sure, I will discuss that. And thank you, Prashant. Okay, so if you solve this equation, you can see true negative will cancel out. What we get is false positive by true negative plus false positive, the same as here. That's why false positive rate is equal to 1 minus specificity, because formula wise also they are same. Okay, so we can either write in the x-axis, either we can write false positive rate or we can write 1 minus specificity. Both are same thing. Similarly, on the y-axis, we can either write sensitivity or we can write 1 minus true positive rate, and so sensitivity is same as true positive rate. Okay, this both are the same thing. Now, the purpose of ROC curve is two. First purpose is when you have to find cutoff for a screening test to detect threshold or cutoff for a screening test. Threshold or cutoff. What are the various cutoff? For example, for sugar, fasting blood sugar, the cutoff is 126. More than 126, you are diabetic. For hypertension, the systolic BP more than 140 is hypertensive. So 140 and 126. How did we get this number? We get this number through ROC curve. ROC curve help us in detecting threshold or cutoff for every test. Every screening test or every test is detected by ROC curve. The second purpose of ROC curve is to compare between two or more diagnostic tests. Two or more tests. Suppose you want to compare that urine sugar estimation is better or blood sugar estimation is better. How will you decide which one is better? Again, with the help of ROC curve. How we do that? Suppose we did blood sugar testing of 100 people, and when I am doing the blood sugar testing, I put the cutoff as 90, let's say. So when I took cutoff for fasting blood sugar as 90, I get a curve something like this from the computer. ROC curve come out from the computer. You just put the data and give the command apply ROC curve and you will get a curve something like this. So this line will come when the cutoff for fasting blood sugar is 90. So at 90 cutoff, we know that many of us also will come positive, because I know even my blood sugar is more than 90. It means I will be in the side of false positive, because actually I think I am not diabetic, and I know I am not diabetic. I am not going for urination for more than one time in night, and I don't have any symptoms also, and I have not done the test. But many of you at least who are false positive will also come out here, and there will also be some people who are true positive who will be detected. So this point is of no use of this cutoff, because this cutoff is giving you 50% positive which are true and 50% which are wrong. So you can toss a coin why you are doing this test, because even a coin will give 50% head, 50% tail. So this test is of no use. But when you increase the cutoff, and suppose you increase the cutoff from 90 to, let's say you increase the cutoff to 110. So now the fasting blood sugar is equal to 110. So this time you can see in the image that true positive is same true positive. But this time the false positive is very less false positive. So this 110 is a better cutoff. But if I increase the cutoff to 126, I will get a curve something like this. It will, so at fasting blood sugar 126, you can see that the true positive is the same, but the false positive is very, very small. See, very small false positive. Here we are writing false positive. It is very small. So 126 is the best cutoff because it is the line under which maximum area of ROC curve come. Under 126, if you see the area, it will be whole of this will be the area of 126, whole of it. So that cutoff will be better, which has maximum area under the curve, and that is 126. That's why we took 126 as the cutoff, because it came out from ROC curve. Now, suppose you want to compare between urine sugar and blood sugar. So urine sugar will be something over here at the place of 110, and if you plot it from blood sugar, the curve will be something here, much upright. Okay, because blood sugar is better test. Why it is better test? Because again, the area under blood sugar test is much more than area under urine sugar. And so blood sugar is a better test than urine sugar. Okay, so this is the two U's of ROC curve, and these are the X and Y coordinate that we write. Please remember that on X axis we have false positive or 1 minus specificity, on Y axis we have sensitivity or true positive rate. Okay. Now, there are 3 questions which I have got. Three questions we have which you asked. One thing, actually 4. 4 question which you have. First question is, let me go from below. Reshma Anjum is asking a very useful question because it is very commonly asked in recent exams. So the difference between coefficient of determination and coefficient of regression. And what is the difference? What is the difference? It's a good question. See, if I am plotting 2 plots, let's say I am plotting between, let's say anything, let's say I am plotting between happiness and hour of, let's say hard work. Okay, so you think that hard work do not give happiness, usually party give us happiness, but that is just the opposite of what you think. Because in the day when you have read for 6 hours or 8 hours, in that day you are actually most happy from yourself. If you have done a party, you will be happy, but not that much happy when you have done a whole day of study according to your wish. And internal happiness is more. Now, so always try to attain the internal happiness, because that is the true happiness. So let's say I am plotting the curve over here, and let's say I am plotting the curve between happiness and number of party, and I am getting it over here like this. Okay, and they ask the question that which one has more correlation coefficient. Okay, so let me make it more better and not okay like this. Okay, so if they are asking which one has more association, which one has more correlation coefficient, so how we find the correlation coefficient R? We draw a central line and we find out the distance of each point from that central line. That is known as correlation coefficient. What is correlation coefficient? This R is the least square distance of each point from the central line. Least square distance of each point from central line. Okay, so in this case you can see that the dots are more close to the central line. So here the R will be, let's say, something around 0.8. But in this line, if this is the central line, the dots are more far apart. See, they are more far apart. So here R will be something less. Let's say it will be 0.6. Okay, so this is correlation coefficient, least square distance of each point from the central line. And what does correlation tells us? Correlation tells us the direction of association between two variables. Direction of association between two variables. Okay, so actually happiness is not directly proportional to hours of attitude. I think also I should also add the word gratitude. If you are happy with what you have, and if you have gratitude along with hard work, there is more chance that you can be happy. But if you are complaining all the time, even if you are partying, you will not be happy. And we should have some gratitude to remain happy life, and that's a clear thing we all know. So correlation tells us direction and correlation coefficient least square distance. But if we do the square of R, that is known as coefficient of determination. And in this two example which I have given, the R square over here is 64 and the R square in this case will be 36, because 0.6 into 0.6 is 0.36, but 0.36 means you can say 36%, and here 64%. So R, if you do the square, it is coefficient. What does it mean? Coefficient of determination, what does it tells? R square, it tells percentage variation in one variable on changing another variable. In one variable on changing other variable. Okay, for example, if that means what does percentage change in one variable on changing other variable? What does it mean? It means according to the first curve, 64% variation in happiness can be explained by change in hard work and gratitude. Okay, 64% variation in happiness is can be explained by 64% variation in happiness can be explained by variation in gratitude and hard work. And we all know this. If you are doing exercise and if you are happy with yourself, your gratitude and hard work will make you feel happy from inside. But only 64% of happiness is depending on these two according to this plot. Okay. Now, what is the last thing? Coefficient of regression. And coefficient of regression is not denoted by any symbol. The R which we use, this R is correlation coefficient. It is not coefficient of regression. Coefficient of regression do not have any symbol. And what does it tells? It tells exact variation in one variable on changing other variable. So, what is the difference between coefficient of regression and coefficient of determination? The difference is that coefficient of determination is telling you percentage variation in one variable on changing other, but regression is telling you exact variation in one variable on changing other. Now, second difference is that, so main thing is it is saying the percentage variation only, but here it is giving you the exact variation. The second difference is that coefficient of determination come from a scatter plot. It is derived from correlation coefficient and it is derived from a scatter plot. This dot which we have drawn and we have find that axis, that is a scatter plot, which help us in finding the coefficient of determination. But to find coefficient of regression, we do not draw the scatter plot and we directly found the try to find the association between y and x by drawing one line and finding out the angle over here. Okay, so we try to find the angle m and we try to find the constant c. Okay, and then if it is a simple linear regression, for simple linear regression, the formula is y is equal to mx plus c. This is for simple linear regression. So if we know the angle m, because angle m is usually kept as 45 degree, and if it is tan 45 degree, it means it is 1. So we know the m, and c is a constant. So let's take c equal to 5. So if we put x as 10, what will be the y? In this example, what will be the y? Y is equal to mx plus c. So it will be equal to 1 into 10 plus 5, and it will be equal to 15. Now, if you double the x in the second scenario, if x is doubled, what will be y? If x is doubled, in this case, y will be equal to 1 into 10 into 2, because now it is doubled, plus 5. So it will be 25. So we know that if x is doubled, y changes from 15 to 25. We know the exact variation in y on changing x. On doubling x, y changes exactly by 10 marks here, and it changes from 15 to 25. So we know the exact variation by r, by coefficient of regression. But coefficient of determination tells us what is the percentage variation in one variable which can be explained by other variation. Like what is the percentage variation in your happiness with change in your gratitude and hard work. Okay, so percentage variation by coefficient of determination and exact variation by coefficient of regression. Now I would like to tell two more things here, that this is for simple linear regression. But what is the formula for multiple linear regression? Multiple linear regression, and what is the difference of between simple multiple and logistic regression? Okay, and logistic regression. So multiple linear regression means any factor is dependent on more than 1, 2, 3 things. Let's say I am talking about happiness. So happiness not only depend on your hard work and gratitude, it also depend on your past. Suppose you had a breakup and you will be under some stress, and the happiness will not be that much, or it may be that you are very happy after the breakup. It can also happen. So one factor is breakup, one factor is exam stress, one factor is family background and genetics. So there are many factors which affect our happiness. But that's why if we are writing the formula for multiple linear regression, it will be m1 x1 plus m2 x2 plus m3 x3. Okay, m is the different angle and x are the different factor till we go to mn xn. So they are depending on multiple factor, that is multiple linear regression. And in logistic regression, we try to find out, it is for dichotomous variable. Dichotomous means yes, no, pass, fail, diabetic, non-diabetic. They all are dichotomous, only two things. For example, in NEET exam, suppose we are writing the pass over here. I am writing the result of the NEET exam, let's say, and it is pass over here, fail over here. So in the beginning, they had put a definition for your NEET exam that if the percentile is up to 50 percentile then the student will not be selected for admission. But if the percentile is more than 50, it means you are pass. So here pass and fail, what are these? Pass and fail, these are dichotomous variable. Okay, and we simply do the same thing for hypertensive, non-hypertensive, diabetic, non-diabetic. For example, how we do for hypertensive? Here we write non-hypertensive, here we write hypertensive, and we took the cutoff at 140 systolic BP. So if the BP is more than 140, let's say it is 150, 160, it means you are hypertensive. If it is less than 140, you are non-hypertensive. So hypertensive, non-hypertensive is also a dichotomous variable. So if you are getting a plot something like this, it means it is showing logistic regression. And the formula for logistic regression is something which is very unuseful, but still log y by 1 minus y is equal to m1 x1 plus m2 x2, because it can also depend on multiple factor. So till mn xn, it can be simple logistic regression or multiple logistic regression. If it is multiple logistic regression, there will be many factor plus c, and if it is simple logistic regression, it is simply log y by 1 minus y is equal to mx plus c. But usually it is always multiple logistic regression that we use. We never use simple logistic regression in most of the cases, but if you are using, it will be like that. Okay, so logistic regression is for dichotomous, simple and multiple when we are using many factor or one factor. Now Dr. Prasad, you are thank you, shukriya. Let's move ahead and discuss the next doubt, which was, one of the doubt was between mixed cohort and nested case control. What is the difference between mixed cohort and nested case control? Then one of the student asked about different type of study, how to find it. So let's discuss both of it, and then I will come to absolute risk reduction asked by Ashish Mishra. Okay, so mixed cohort and nested case control. Okay, what is the difference? Only one difference. In nested case control, cases or control are added at the end of study period. Okay, and in mixed cohort, cases or control are added as they appear within the study. Let me explain how they are. As they appear during the study. Okay, so in nested case control we are adding them at the end, but in mixed cohort we are adding them in between. And we all know that both nested case control and mixed cohort simply means that you are mixing two things, cohort plus case control. If you mix both of it, it is known as nested case control or mixed cohort. So let's take an example to understand it. Okay, suppose you want to know all the side effect of OCP, and for that you are doing a study in which, let's say, there are 100 female on a new OCP. Okay, and you want to know that whether this new OCP is causing deep venous thrombosis or not. Deep venous thrombosis is a rare thing, but let's say we are measuring whether it causes deep venous thrombosis or not. So this 100 female on new OCP, since 2018, these 100 female are using this new OCP. Now, you started a cohort study in 2020. Right now you started a cohort study. Or let's take some more previous year to make the example much better. We can take it as 2000, let's say 14. So they are taking it since 2014. And in 2018, you started in 2018 started a cohort study. Okay, to know the side effects. So when you started this new study, out of this 100 female, some female has already had the side effect of DVT. Let's say out of these 100 female, 5 developed deep venous thrombosis, developed DVT. In this last 4 years, 5 cases of DVT occurred. And out of these 100 female only, because you have taken 5 female who developed DVT, you will also take 5 female who take OCP but do not develop DVT. So these two groups are coming from this 100 female only. And how you got this data? By taking the past history. So in 2018 you are starting this study and you did this study, let's say till 2020. In 2020, and when you ended this study in 2020, let's say there is +3 new cases of DVT. So now there is 8 DVT side effect female. Because you have added 3 people in the case group, because these are the people who have disease, these are the case, and these are the people who don't have disease, so these are the control. So because you have added 5 people in the case group, you will also add 5 people in the control, 3 people in the control group, because 3 in the case, 3 in the control, and therefore there will be 8 female without DVT who are taking the OCP. So this is an example of retrospective cohort or nested case control, because you are doing a cohort study here and at the same time you are getting this 5 cases data from the past. So you are using the past history, started a cohort study to know the side effect and also take past history. So if they also take past history, it means it is a nested case control or retrospective cohort, because this part is case control when you are taking the history from the cases and control, and the future part is cohort. Now here all the 3 case and 3 control are added together, but suppose they are not added together. Suppose 1 case is added in 2019 and then 1 more case, 2 more case in 2020. So you are adding it gradually. If you are adding here cases gradually, you will also add control gradually. So +1 in 2019 and +2 in 2020. So here in this example we are adding them gradually. So this is a mixed cohort, because you are adding them gradually, not combinedly at the end. But in this case, when you added +3 directly at the end, added it end, so this is why, that is why it is nested case control or retrospective cohort. Okay, nested case control, because you are adding the 3 cases together at the end, not gradually. Okay, so if you add it gradually, it is mixed cohort, otherwise nested case control. And this is how they ask the question. They will ask that you started a cohort study and took a past history. Like they can say that you started a study on association of BD smoking with throat cancer, and you took past 20-year history and you did a cohort in future 10-year also. So 20-year past, 10-year future. This is nested case control, because you are taking past history moving forward. So they can ask this type of question. like a group of nurses had IUCD implanted and some of them had side effect, and you started a cohort study after 1 year of IUCD implantation, and you did this cohort study for next 2 years, but you also take data of past 1 year. So which type of a study it is? It is nested case control or retrospective cohort or mixed cohort, okay? Because broadly all these names are same, okay? The minor difference between mixed cohort and nested case control is something which we already discussed right now, okay? Now, one of the student has also asked how to identify between cross-sectional case control and cohort study, because in recent exam they gave a lot of question from identification. Let me ask you a question also from identification. So the question is that effect of study was done to know association of mobile phone use with depression. I am not saying there is any association, there is a study which was done, okay? But when we use mobile phone like Instagram and Facebook, we compare ourselves with other people who are more happy on the Facebook and Instagram. So this comparison is something which gives us anxiety and depression. If you are not comparing yourself, it means it's good. So study was done to know association of mobile phone use with depression, and group of student with depression using mobile phone is compared with group of student without depression using mobile phone. Okay, so tell me which type of study design it is. Option A, is it a cohort? Option B, is it a case control? Option C, is it a RCT? Option D, is it a case series? Or option E also, is it a retrospective cohort? So try to give the answer. Framingham study, please explain. Okay, I will explain. Setu is saying, okay. Death certificate in COVID case. Okay, we will discuss that. But first here, tell me the answer. Retrospective study, retrospective cohort. This study is an example of which of the following? A, B, C, D, E. What is the answer? Hello, Kuldeep. Okay. Thank you, Reshma. Right now, tell me, what is the answer? I want to have the answer. I should have by now. Because, okay, there is a delay between the transmission. But in this case, what is the answer? Try to give me the answer. I know many students will think that it is a cohort study, because here what we are trying to do is we are trying to get association between an exposure with disease. But the correct answer is case control, because what we are starting with, where our studies start, this decide that which type of study it is. We are starting with student with depression and student without depression. This is how we are starting. That means we are starting with disease and control. So this is a case control study, because a case control study starts with disease and non-disease. Good. Thank you, Arkisman Beg, that you gave the answer, even if it is right or wrong. In the class, any answer is right, and we need not to worry. Thank you for giving answer. Mukesh Jat is correct. It is case control. Kuldeep is also correct. So, because case control start with disease and non-disease. Similarly, this is case control start with disease and non-disease, that means case control. Suppose it starts with exposure, exposed or non-exposed. Suppose in the question, they would have started with one group who use mobile phone, one group who don't. And then in future, after 2 years, they would have looked for depression. Then that will be cohort. Because one group is using mobile phone, one group is not. But they are started with depression and not depression. So it is case control. If they start with any risk factor, one group who is doing the risky behavior, one group who is not, then that will be cohort. If they start with random allocation, or if they start with, and a question starts with, and a study starts with. So we have to look what the study starting with. If it is starting with random allocation or any new drug with placebo, okay, or experiment, it means it is RCT. So you have to look what it is starting with. Now, second way to decide which type of study it is to look for keywords. There are some keywords. If these keywords are present, then mostly we can decide the study very quickly. For example, if the keyword is hospital data, if there is hospital data in any question, keyword in question, in a study. So hospital data mostly points towards ecological study, because the other name of ecological study is correlational study. And in correlational study, we correlate hospital data with population data. So if you are using hospital data and population data, it is definitely ecological study. But if only hospital data is present also, it means ecological study. So in one of the recent exams, they ask that cases of lung cancer is compared with sale of cigarette in that area by taking data from taxation department and shopkeeper. So you are taking data from shopkeeper and taxation department, that is population data, okay, sale of cigarette data, and you are comparing it with lung cancer cases. So lung cancer cases is what? It is hospital data. So if you are comparing lung cancer cases with sale of cigarette data, it is correlation, you are correlating them. So that is ecological study. If the keyword is prevalence, we all know that prevalence study means cross-sectional study. So if you find prevalence word, answer is cross-sectional study, very simple. Okay. Similarly, if you find follow-up study, follow-up study is used for two type of study. One is definitely cohort, because the other name of follow-up study is cohort study. Okay. And one more thing in which we do follow-up is RCT. Cohort or RCT can be there. But RCT is not known by the name of follow-up, because in RCT we give the drug and we follow up, but under controlled condition, not under natural condition. So RCT is not known as follow-up study. So if you find follow-up study, mostly the answer is cohort. But you will look more carefully if they are comparing a drug with the placebo, or if they are doing random allocation in a follow-up study, then it will become RCT, because RCT is indicated when there is random allocation or experiment. Okay. So these are some of the things which I wanted to take here. Amal Roy is asking me to have a Telegram group for doubt clearing. This is something which I should have done long ago, but I have not done it till now. And because of some personal reason and because of using this phone which I use. Okay, so but I should definitely give answer to your doubt, and I will use phone of my friend 1 hour per day. I will create a Telegram group. Tomorrow only I will create a Telegram group. Today only I will create a Telegram group after the class, and this is my email ID and this is my phone number. So you can call me directly or you can message me if I did not open a Telegram group. I will open a Telegram group and I will update about the Telegram group in the Bhatia, and the name of that Telegram will be Ashwani PSM doubt clearing group. Okay, that will be the name. Okay, and I will update it in Bhatia. I should have done it earlier, but I am not doing it, but I should give 1 hour for your doubt every day, which I will give at this Telegram group also. Now let's come here and answer clear some more doubt. One of the question was attributable risk reduction by, I don't know the student, I forgot the student name, my friend name, but that was, some of you have asked it. Ashish Mishra. So let's come to that absolute risk reduction. Very simple thing, but it's a new concept, so we need to understand. Absolute risk reduction. We call it by the name ARR. Okay. What is this? Absolute risk reduction means percentage of cases or proportion of cases in control group. Control group is also known as placebo group. Okay, minus proportion of cases in treatment group. Because what do you mean by risk reduction? Risk reduction means how many less cases are occurring in those group in which you are giving a new drug. Let me give an example to make it more clear. Suppose I am trying a new drug, Coronil, okay, or any new drug, and you can take any example. So I am giving Coronil to 100 people, 100 person, and I am giving just a placebo. Let's say I am giving only vitamin C, or let's say I am only giving a placebo, nothing, 200 people. And after giving Coronil for, let's say, 3 months, I did the antibody test and I found that how many of them are COVID positive, COVID-19 positive for antibody test, because antibody will tell us about the past infection, whether the past infection occurred or not. So Coronil gives the guarantee that they will prevent the infection. So if Coronil is effective, there will be no COVID-19. And then here we will have those who are COVID-19 negative by antibody test. Okay. So this COVID-19 negative are those who are non-disease, and this COVID-19 positive, these are the cases. So suppose out of 100 person, after 3 months, let's say here we have 20 cases. Sorry, here we have 10 cases which are positive, because I am just for the case I am taking that it is more useful, 10 cases. And suppose here it came 20 cases. So out of 100, if you remove 10, it will become 90 will remain, and if you remove 20, 80 will remain. So this data was published, suppose, in the magazine, saying that Coronil is useful because Coronil, in the Coronil group only 10 people developed corona, but in the placebo group 20 people developed corona. And Coronil is a very good drug. Suppose this data is published in the article. Now, how will you say that Coronil is good or bad? Based on this thing, ARR. What will be the ARR in case of Coronil? What will be the absolute risk reduction for Coronil? If this example is correct. Proportion of cases in control group. What is the control group? Placebo is the control group. How many cases occurred in control group? 20 cases. Out of how many people? Out of 100 people. So 20 by 100. This is the proportion of cases or incidence in control group. Incidence in control. Okay. And you subtract it from the cases in treatment group. What is the treatment group? This Coronil is the treatment group. So in the treatment group, it is 10 by 100. 10 cases are there out of 100. So if you solve this equation, 100 will be here and 20 minus 10, so it will be 10 as the numerator. So it will come out to be 10 by 100 means 0.1. So absolute risk reduction is 0.1. What does it mean? It means that there is one more thing which we need to calculate. Number needed to treat. This number needed to treat is equal to 1 by absolute risk reduction. Okay. Now, here the absolute risk reduction is 0.1. So 1 by 0.1, it means what? It means 10. What does it mean? It means that number needed to treat is equal to 10 and ARR is equal to 0.1. Number needed to 10 means that if corona has to be prevented in one person, then 10 people should eat Coronil, should be given Coronil. Not so clear? Let me make it more clear. NNT of 10 means that when 10 people will receive Coronil, out of 10, 1 will be protected. That means if 10 people get Coronil, only 1 will be protected by corona. 9 people are not protected. 9 people are not getting advantage. Okay, so will you say this drug to be very good drug? Of course not. Because if NNT is 10, it means out of 10 people, only 1 will be protected. So that is what number needed to treat means. Number needed to treat. How many people you need to treat to get advantage to one person? Number needed to treat to give advantage or safety to one person. Give advantage to one patient. Okay? Or you can say that the absolute risk reduction is 10 by 100 or 0.1. And so absolute risk reduction means when you take the drug, how many risk, what is the percentage of risk which is decreased by taking the drug. So the percentage decrease is 0.1. That 0.1, or you can say percentage decrease, absolute risk reduction is 0.1. It means that you need to treat 10 people to give advantage to 1 people. Okay? Is it clear? Number needed to treat and absolute risk reduction. How it is happened? What Abhinav Sharma? What are you asking? Sulabh is asking why we are saying parametric and non-parametric. Okay, why we say something as parametric and non-parametric. I will discuss that now. But before that, are you clear with this concept, ARR and NNT? Let me know in the group. If you are okay, I will move ahead. Otherwise, I will give you one more example to explain it. Okay, I think you are clear. If not, let me please ask the question. So this is absolute risk reduction, okay, which is proportion of cases in control group minus proportion of cases in treatment group. आ गया सर जी, गर्दा क्लास. Okay, शुक्रिया आशीष मिश्रा. Okay, let's come here to discuss the next question. Why we say chi-square and student t-test as parametric, non-parametric? Okay, you are going conceptual here. Okay, parametric and non-parametric. Actually, in parametric, we are doing test on those variables which are normally distributed. So this parametric test applied on normally distributed data. Okay, and there was one more question about skewness of curve and box and whisker plot also. So we will discuss that also after this, parametric, non-parametric. So parametric applied on normally distributed, and non-parametric because it is applied on non-normal distributed, applied on non-normally distributed. Non-normally distributed can also be called as non-parametric because the distribution is normal, so it is parametric, non-normal, so it is non-parametric. Now, non-normally distributed means they are skewed, and there is two type of skewed curve we all know. This is positive skewed curve because it is on the right side, the skewness is there, and this is negative skewed curve, and this is positive skewed curve. And remember, in positive skewed curve, mean is greatest, mean is here, mean is greatest. If you remember this, you will remember the sequence, because if mean is greatest, in the middle there will be always be median, median always in between. So if you remember mean is greatest, then the sequence will be mean, median and mode. And in, of course, in negative skewed curve, if mean is greatest in positive, then in negative there will be mode will be greatest, and then there will be mode, median and mean. And so this will be the sequence, and a mode will be always on the top, median always in between, and mean always towards one side. Okay, so one difference between parametric, non-parametric. Second thing is that in parametric test, of course, we are doing it on quantitative data. So it is done on quantitative data, and quantitative word itself means parametric in a way. Quantitative means parametric and qualitative means non-parametric. So it is done on qualitative, that's why also it is known as non-parametric. The main reason of calling it parametric, non-parametric is that it is quantitative is parametric and qualitative is non-parametric, qualitative data. Now there is two other point of difference between them. One thing is that in parametric, P for parametric, so we apply Pearson correlation coefficient here. Pearson correlation coefficient is detected here. And in case of non-parametric, we get Spearman correlation coefficient. Spearman correlation coefficient. Okay, so these are some of the differences. Because it is quantitative, so the data will be in mean, data in mean or standard deviation. And because it is qualitative, so the data will be in percentage or proportion, in percentage or proportion. Okay, if the data is in percentage proportion, non-parametric, otherwise parametric. In the recent exam of NEET, they ask which of the following is a non-parametric test, and option were student t-test, ANOVA, then there was a Friedman test or unpaired t-test. So the answer was Friedman test. Okay, so we have to remember the name of parametric, non-parametric. Just let's quickly do that, because we remember the name and we forget, especially non-parametric part we forget. So let's try to remember it forever. If there is one group of data And because sometimes they also ask that in this situation which test you will apply, and this question is very common. So when they ask number of tests, you just have to see two things. First thing, how many group is there. So if there is one group of data, for parametric it is paired t-test, which is also known as dependent t-test, because the two group are dependent, dependent t-test. But for non-parametric side, it is sign test. The other name of sign test is Wilcoxon rank sign test. Okay, and the one more name is McNemar test. So these three tests are applied for one group of data, which is qualitative. We all know this is non-parametric. So qualitative means non-parametric. Okay, non-parametric test. Now, suppose there is two group. What are the various names for two group? When there is two group of participant data, then first thing which we have is, we all know it is unpaired t-test or student t-test, unpaired student or independent. And this we know, independent t-test. Okay, but when it is non-parametric, now the first name is chi-square. We all know chi-square is used for two group or more than two group, both. Second name is Wilcoxon rank sum test. Rank sum test. So the difference is very small. If they have rank sign test, it is for one group. Rank sum test, two group. Third is Mann-Whitney U test. Mann-Whitney U test. This is also for two group qualitative data. Okay. Now suppose there is three or more group. There is one more name which we have in this above example. There is one more. We can say it as chi-square test or Fisher exact test. Fisher exact test. When we apply Fisher exact test, when sample size is less than 30, we apply Fisher exact test. If sample size is more than 30, we apply chi-square test. Okay. So there are four type of tests which we can apply on non-parametric or qualitative data of two group. But there is three or more group. There is only one name, ANOVA, which we all know is analysis of variance. Okay, analysis of variance. But here in this group, what are the name? First is chi-square again, because chi-square, as I said, for two or more than two group. Second is Friedman test. Friedman test is a non-parametric test for more than two group. And third is MANOVA. Okay, so these three are for three or more group. Try to remember this table, and if they ask any question regarding which test will be applied, only think how many group, which type of data, and decide it. Okay. Shukriya Sadaf. Let's you promised video. I have uploaded the video of MDR-TB. I had promised that I will also upload the video of dengue treatment. But the dengue treatment video I have not uploaded. I will upload the dengue treatment. Third thing which I said I will upload was stages of pandemic, which I have uploaded in the COVID update. And stages of pandemic, dengue and MDR-TB, three things which I had said I will upload. I have uploaded MDR-TB and stages of pandemic and recent update on COVID-19. But I have not uploaded dengue fever management, which I will upload. Thank you, human being, you are for reminding me. Now, so this is what are the questions till now. And why it is parametric, non-parametric, we got it. Separate telegram group we have answered. Okay, Framingham study, please explain. This question was from Sachin Grihpunje. sorry for pronouncing it wrong, don't mind it, है ना, don't be emotional about the name. We have more people who are already emotional about names. The question is Framingham heart study. Okay, one more thing I had said is, I remember what else I have said, and a Framingham heart study. So in Framingham heart study, this study was done for 54 years, and it was a cohort study done among doctors. For 54 years. And in this study, they have taken one group of doctors who are a smoker, one group of doctors who were non-smoker, and they also took one group of, along with a smoker, they also take the characteristic of, along with smoking, they also take characteristic of alcoholism, okay, alcoholic. Because usually people who drink alcohol, they also smoke, not always, but usually. And there is another group who were non-smoker and non-alcoholic. And with the help of these two groups, they tried to find out that what are the various risk factors for myocardial infarction and for heart disease. Okay, in which of the following there is an heart attack or heart disease, and here how many develop heart disease. So all the data which we read about cardiovascular diseases, that eating fatty diet causes cardiovascular disease, है ना, smoking causes hypertension or drinking causes hypertension, they all came from Framingham heart study, which was a cohort study done by later. For 54 years, they kept sending letter to both the group and they kept collecting the replies. And with that, we came to know about everything about cardiovascular disease. Okay, so this was the Framingham heart study. For the association of smoking with lung cancer, that was told by Doll and Hill study. Doll and Hill study. And Hill study. So what was the purpose of Framingham heart study? Purpose of Framingham heart study is to know association of various factors with myocardial infarction. Association of various factors with heart disease and myocardial infarction and heart disease. What are the various factors which lead to heart disease and MI? But in Doll and Hill study, the purpose was to know association of smoking with lung cancer. And Doll and Hill study was the one which proved that even passive smoking can cause lung cancer, because this Doll and Hill study was also a cohort study. Okay, they had one group who were a smoker, of course, one group who had lung cancer, and one group who have no lung cancer. No, this was a cohort study. So it cannot start with lung cancer and no lung cancer, otherwise it will be case control, है ना? So if it is a cohort study, it must start with a smoker and non-smoker. Okay, it started with a smoker and non-smoker, and then after 20 years they were measured that how many of the smoker develop lung cancer and how many of non-smoker develop lung cancer. So it was found that some of those who were non-smoker but they were married to a smoker or they were living with a smoker, they also developed lung cancer. है So there is one group smoker, one group non-smoker. Among non-smoker, some people developed lung cancer, and of course some people developed no lung cancer. So this lung cancer, many a time these were passive smoking cases, okay, due to passive smoking. They are non-smoker but still develop it due to passive smoking. Okay, and here passive smoking and other factors are also there. Again, here we will take some cases of lung cancer and some cases of no lung cancer. Okay, so it is cohort because we are starting with exposed and non-exposed, and we are going towards the outcome. Okay. Thank you. Let's look at any other question. Sabyasachi Das has asked me about telling the death certificate in COVID case. And Sabyasachi, I do not know that there is any difference between death certificate of COVID or not. I will study that, and we have our next session on 23rd. So in 23rd, the first thing I will start with is death certificate on COVID cases. But this is a update thing which I don't know, so I should have known, and I will tell it on 23rd when I have the next course topic. Okay. Coefficient of determination and regression we have explained. And please explain cohort, case control and cross-sectional study. This question was from Bikram, and we have discussed how to find cohort, case control and cross-sectional. But let's, for a simple thing, one main concept is that we always focus on like things, what is the direction of a study, to differentiate between a cross-sectional, a cohort and a case control. If the study is done at present moment, then this is a cross-sectional. Okay. Suppose I want to know how many of you are, let's say, how many of you are using Netflix on your phone. So suppose I found that 10 people out of 100 are using Netflix. So this is at now, right now, how many of you are using. So that's why it is cross-sectional study, because it tells you about the present moment, and it tells how many of you have Netflix. So what is the prevalence of having Netflix on the phone. Okay, so that's why it is cross-sectional or prevalence study, and one more name is snapshot study. But if we are going in future, of course there is cohort, and there is one more study which we do in future. What is that? If you know, you can tell. If we are going in past, of course the study will be case control. So to decide which type of study it is, you have to look whether it is going in past, going in future, or in the present moment. Second thing you have to look is what it is starting with. If it is starting with exposed, non-exposed, it is cohort. Starting with case and control, it is case control. Disease, non-disease, it is case control. Starting with experiment and random allocation, it is RCT. But the one more way of differentiating is what is the direction of a study. Okay, one way is how the study start, other way is what is the direction. So what study we do in the future? In the future, you are not saying it, but the second study is RCT, and I know that you know. Okay, so RCT is also done in future. That's one of the difference between them. Okay, any other question if you have, feel free to ask it. Any free question, any question, because we have discussed the questions which you have asked. This, I know okay, one question was from Soumya R. Teach box and whisker plot and skewness. Okay, why not, Soumya? In box and whisker plot, very simple thing is we have one box and one tail. So the tail is known as whisker. So this is the box, this is the whisker. This box it remain between the first quartile 25% and the third quartile, that is 75%. Between these two things we have box, and the central line of it represents Q2. Usually it is the median and it is at 50 percentile. Okay, it is at 50%. Now, this whisker is here, and if suppose we have taken between 0 to 100, so 0 will be somewhere here, 25 here, then 50 here and 100 here, sorry 75 here and 100 here. Okay, so $75 and $100. We have divided 100 into 4 equal parts, and each part is known as quartile. So between 0 and 25, this is the first quartile. We call it Q1. It is at 25%. Okay. This is the second quartile. This between 50 and 75, we have third quartile, and then this part is the fourth quartile. And first quartile, here it is second, here it is third, and here it is fourth quartile. Okay, so this is a box and whisker plot. What is the purpose of box and whisker plot? The purpose is to find outlier. Suppose we have divided 100 into 4 equal parts, then we can draw the box from 25 to 75, and the whisker will go till 112.5, and here it will go till minus 12.5. So if any number is outside the whisker, if any number is very out, that will be outlier. In your class, if a student is getting 200 out of 200, he or she is an outlier because very wide apart. Similarly, if someone is getting 0 out of 200, he or she is also an outlier. So outlier is someone which is totally far away. Okay. So in a box and whisker plot, we draw the box between Q1 and Q3, and if someone is outside the whisker, then we call it outlier, and that's how we identify it. Now, why it is minus 12.5? Because the length of whisker is equal to 1.5 times interquartile range. What is interquartile range? Interquartile range means distance between any two quartile. Okay, distance between any two quartile. So what is the distance between any two quartile? It will always be 25%, because quartile means 4 equal parts. So if you have to find the distance between any two quartile, it will be 25% of total data, because distance between any two quartile means you can say midpoint of second quartile minus midpoint of first quartile. Okay. So what is the first quartile? It is 0 to 25. What is the second quartile? 25 to 50. So what is the midpoint between 0 to 25? Midpoint will be 12.5. And what is the midpoint between 25 and 50? That will be 37.5. Okay, midpoint between two quartile. So if you try to find out the midpoint of second quartile, it is 37.5. Midpoint of first quartile, it is 12.5, and the distance between them will be 25%. As I said, it is always 25% of total data, because here the total data was 100, so it is 25, because the total data was 100. So 25% of 100 will be 25. So if you multiply 25 with 1.5, 1.5 into 25 is equal to 37.5. If you add 37.5 in 75, it will become 112.5. And if you subtract 37.5 from 25, it will go to minus 12.5. That's why the whisker is not restricted up to 0 and 100. It go beyond 0 and 100. Okay. So this is a box and whisker plot in which the length of whisker is equal to 1.5 into interquartile range. Okay. Now, one question that they ask sometime is they give you a plot, and in that plot they will not give you anything like this. They will only give a plot something like this, and they will put like this, and they will ask that this plot represent, what does it represent? Does it represent positive skewed curve? Does it represent negative skewed curve? Does it represent normal curve? Or does it represent insufficient data? What does it represent? So to answer this question, try to imagine this type of box and whisker. This is a box and whisker plot, but they are not asking whether it is box and whisker or not. They are asking which type of curve it is. So to answer it, we can imagine it on this type of plot. This is the y-axis, this is the x-axis. That's how we write it. Okay. Y-axis always increase in this direction, x-axis in this direction. So let's say we have 20, 40, 60, 80, 100, 120, 140, 160, like that we have some data, 180 and all. So here, this is a box and whisker plot, and in this plot if you draw a curve, it will be something like this. Okay. And this curve, this part is the skewed part, because skewed means stretched. This one is stretched, and this part is a straight part. Okay. Now, the straight part is between 140 to 120, which are higher number, and the skewed part is between 120 and 60. Okay, so this 120 to 60, these are lesser number. 120 to 140, this is higher number, है because 60 to 120 is less as compared to 120 to 140, that is bigger number. So if skewed part is towards lesser number or left hand side, then we call it negative skewed. Left hand side is skewed or skewed parts towards lesser number, we call it negatively skewed. So the correct answer is negatively skewed curve, which I think you all, if you have answered, you would have, yes, we get a curve like this, and the answer is it is negative skewed curve. Very good, Avinash Mukherjee, you are correct. Okay. Now, suppose I want to draw a positive skewed curve. How will you draw it? A positive skewed curve will be plotted something like this. Same as, but this time the line will be below. So if the line is below, it means the plot will be something like this. And if plot is like this, it means this part, this is the straight part, and it is towards lesser number. This part, which is a skewed part, is towards right hand side or towards bigger number. Okay. So this is the two way to identify right and left skewed. One way is to look whether it is right hand side or left hand side. Second way is to check whether the skewed part is towards bigger number or lesser number. Because here also, suppose it is 20, 40, 60. So between 20 to 30 we have straight part. So straight part is lesser number, skewed part is towards bigger number between 30 to 60. So that's why it is positive skewed curve. Okay, so positive skewed curve. And how does a normal skewed curve will look like? Normal skewed curve will look something like this. %50 on this side, 50% on this side. So this one will be normal skewed curve. Okay, this one will be negative skewed curve because in this curve the median is above. The middle line median Q2 is above. Okay, so the plot will be skewed towards lesser number, so it is negative skewed. So this is negative skewed curve, and this one will be positive skewed curve. Okay, and of course this one will be normal skewed curve. Now if you want to know more about skewness of curve, we can discuss it with a simple example. Like in a hospital, let's say most of the people have out of 0 to 10, most of the people who are depressed have depression around, let's say, 9. Okay, so the question is that if most of patient in psychiatry ward, okay, out of 10, okay, it represent, what does it represent? So if they ask this question 9 out of 10, that means they have given only one hint and they ask what does it represent? Is it representing positive skewed curve? Is it representing negative skewed curve? Or is it representing normal curve? Or the data is inadequate? What do you think is the answer? Because there in this question they have given only one hint, and what is that? The hint is that most of patient, and that is the only hint, most of patient. So most of patient means they have given the mode. Mode means most commonly repeated number. So what is the mode here? 9. So if 9 is the mode, we will draw it something like this. So in this plot, this 9 is the mode, and you can see that this is the skewed part. This skewed part is between 0 to 9. Between 0 to 9 we have the stretched part, the skewed part, and 0 to 9 is lesser number as compared to 9 to 10. 9 to 10 is bigger number. Okay, so here we have the skewed part towards left hand side or towards lesser number or left hand side. So which type of curve it will be? It will be definitely a negative skewed curve, because negative skewed curve has two characteristics, either left hand side or skewed parts towards lesser number. Okay, the same thing we also found in box and whisker plot, that the answer will be that if the skewed part is towards lesser number, then it is negative skewed curve. Okay, same thing is here. We have to know if in the question they have given the mode, so we can find in which direction we have skewed part. If it is towards lesser number, it is negative skewed. Okay, now hello Jasu, Avinash is asking a question about regression. We have discussed it, but let's quickly revise it again. Regression simply means that what is the exact variation, okay, in one variable on changing other variable. If you have any other question also regarding p-value, alpha beta error, regarding parametric, non-parametric, which we discussed, regarding any other topic of biostat, epidemiology, and a health program, anything, feel free to ask, okay. So exact variation in one variable on changing other, this is told by regression. Suppose let's say I decreased my smoking by I had stopped it, and I am not like, but still in between I do it sometimes, sorry for that, but I do. It's a wrong habit and I don't do it. So suppose I decreased my smoking, and because of decreasing my smoking, let's say my cough also decreased, okay. So I can get a plot like this here, okay. So in this plot, this is the angle, you can see this is the angle M, okay, and there will be some constant which will be present. This will be the constant, okay. In a negative curve, this will be the constant. In a positive curve, suppose this is the line, so this will be the constant, okay. So, and this will be the angle M. So in both of the cases, if we want to find the association between cough and smoking, if I want to know that if I decreased my cigarette by half, exactly by how much my cough cases will decrease, cough per day will decrease, okay. So I can know it with the help of regression, because regression Y means mx plus c. X is the smoking, Y is the number of cough per day, M is the angle, and C is the constant. So in this way we can find the exact variation in cough by changing smoking. That's what regression does. It tells the exact variation in one variable on changing another, okay. Good answer, you are correct Avinash, that was negative skewed. So this is what regression is. We have already discussed what is the difference between regression and coefficient of determination. Coefficient of determination tells us percentage variation in cough on changing smoking. That is coefficient of determination. But exact change in number of cough on changing smoking, exact change by coefficient of regression, and percentage variation is by coefficient of determination, okay. Chalo, I am not finding much question now in this group, but Avinash is asking one question, mean more, no, not mean, skewed part is towards higher side, then that is known as positive skewed curve, okay. For example, if I am writing, let's say if I am drawing a plot like this, okay, so in this plot this part is the skewed part and this is the skewed part, and in this skewed part the mean will be over here, median will be in the center, and mode will be the topmost point. So the mean is towards the skewed part, you are correct Avinash, but what I was trying to say is that suppose it is 0, 20, 40, 60, 80, 100, so between 40 to 100, which are bigger number, we have the skewed part. That's why it is positively skewed curve. One reason is because it is right sided, second reason is that the skewed part is towards bigger number, okay. And in a positive skewed curve, as I said, mean is greatest, and you can see it in this image also, that mean is 80, median is something around 55 and mode is 40. So of course 80 is greater than 55 and 55 is greater than 40. That's why mean is bigger than median and median is bigger than mode. But median always remain in center. So just one line, if you remember, that mean is greatest in positive skewed curve, then you need not to remember the sequence, because median is always in center and the third one will be the last one. So this is for positive skewed curve, and the opposite, mode median mean, will be for negative skewed curve. Okay. Now, yes, in eGurukul the TB videos are updated one, and I have added the MDR TB video in that also, in the eGurukul app, so you can, it is updated. Now, one question in the recent exam was from this two thing, that there is this 3 curve they have given and they ask that which one of the following is correct. So one option was that mean is equal to median, but mean and median are not equal to mode, and the other option was mean is equal to median and median is equal to mode. Okay, so in this curve the correct answer is A. Why? The reason was that this is curve 1, this is curve 2, this is curve 3. So if you take the, because this is a uniform curve, and in a uniform curve we all know that mean, median, mode all are equal to center, all are in the center, because it is uniform curve. So mean, median and mode all are in the center. So this is here, this is here, second is here, and third is here, let's say. Okay, let's say it is 2, it is 4, it is 6. So 2 is the mean, median, mode of first curve, 4 is the mean, median, mode of second curve, and 6 is the mean, median, mode of third curve. Now if you ask mean and median of the total, all the 3 curve, then mean and median average can be taken. So average mean and average median of 3 curve is equal to 4, because if you take the average of 2, 4 and 6, it will be 4, because we can take the average of mean and median, but average of mode cannot be taken. Average of mode cannot be taken. Okay, so it is equal to, so the mode is not equal to mean and median. Now when I give this explanation, some people tell me that, sir, mode is also equal to 3 into median minus 2 into mean. So if we took median as 4, mean as 4, the mode we will get is equal to 4. So now mean, median, mode all are equal. But this symbol, mode is equal to 3 median into 2 mode, this is only for skewed curve. If the curve is skewed, only then this formula is correct. Formula applicable for only skewed curve. Because in a skewed curve, how this formula came? In a skewed curve, I have just drawn a positive skewed curve, so you know that mean is here, median is in the center, and mode is at the topmost point. At the topmost point there will be mode. So this is a skewed curve, and now this is a skewed curve, positively skewed. So either it is positive or negative skewed curve. It has been found that in skewed curve difference between mean and mode is biggest. Okay, so the 1/3 of difference between mean and mode is equal to the difference between mean and median. Okay, and if you solve this equation, sorry, 1/3 of difference between mean and mode is equal to the difference between mode and median. Okay, because mode and median are close, so their distance is less, but the distance between mean and mode is greater. So if you solve this equation, it will be 3 mode minus into 3 median. This will be equal to mean minus mode. So on solving it, we can get, okay, we can get the same equation which is here, that mode is equal to 3 median minus 2 mean. Okay, so let me do that. No, it was correct in the beginning actually. When I have written this thing, it is equal to mean minus median, that was the correct. Okay, it is equal to mean minus median, that was correct. Okay, not this one. Actually, it is just a derivation, we need not to go into the detail, but if you know the detail, then you will understand why it is only for a skewed curve, why it is not for normal curve. Okay, so that's what I have written, mean minus median. Now if you solve this equation, that 1/3 of mean minus mode is equal to mean minus median, on solving this equation you will get mean minus mode is equal to 3 into mean minus median. Okay, so let's try to solve it. Mode can go, it will be mean minus mode equal to 3 mean minus 3 median. Okay, so this 3 mean, let mode go there and that 2 come here, so mode is equal to 3 mean will come here, so 3 mean will cancel with 1 mean, so it will be 2 mean, and this 3 median will be positive. So 3 median minus 2 mean, and this will come if you solve it. So that's what I have written, that mode is equal to 3 median minus 2 mean, but it is only correct for a skewed curve, it is not for normal curve. So in this example which I discussed, all the 3 curve are normal, so we cannot apply this formula also, that it is 3 median minus 2 mean, and we cannot get the average mode equal to 4, because we cannot take the average of mode. So mode is not 4. What is the reason mode is not 4? Because we cannot take the average of mode, and this formula is only for a skewed curve, it is not for normal curve. Okay, is it clear? It is only for a skewed curve, not for normal curve. Any other question? What do you mean by random sampling? Okay, Avinash Mukherjee is asking a question. Before that, Sagar is also asking one more question. Number needed to treat, how to calculate. So I already discussed this point, but let me discuss. It is equal to 1 minus absolute risk reduction. This is how we calculate number needed to treat. Okay, number needed to treat. Let me take one more example to make it more clear to you what is NNT, what is ARR. Suppose there is a new drug to treat migraine. So some people will develop vomiting due to it. Okay, if it is migraine, let's say one group has vomiting, let's say one group has migraine, one group has no migraine. So if this is a new drug, some will develop migraine, some will not develop it, no migraine. Okay, new drug is drug X, and we are comparing it with the placebo. So it is given in 50-50 people, and suppose out of 50, when the drug X was given, let's say 5 people had migraine, 45 had no migraine. But when placebo was given, let's say 25 people had migraine, 25 people has no migraine in next 1 month. So if you have to find absolute risk reduction, this absolute risk reduction is equal to number of cases in control group. So what is the control group? Placebo. How many cases occur in placebo? 25 out of 50. This is the incidence in placebo or incidence in control. And we subtract it from incidence in treatment. So in the treatment group, in the drug X group, how many developed cases? 5 out of 50. And there are 5 cases out of 50. Here it is 25 cases out of 50. So this will give us absolute risk reduction which will be equal to 50, and here it will be 20. So 20 by 50 will be the ARR. Now if you want to find the NNT, NNT is equal to 1 by 20 by 50. So in the next step 50 will go above. So it will be 50 by 20 or it will be 2.5. That means if you give new drug X to 2.5 people, then migraine will be protected in 1 patient. Okay? To protect migraine in 1 patient, we need to give this new drug in 2.5 patient. Okay? 2.5 patient need to be treated by this new drug. Okay? To protect 1 case from migraine, 1 patient from migraine. Okay? Like in case of coronil, it was 10, NNT was 10. So 10 people need to be treated to give benefit to 1 people. Here 2.5 people need to be treated to give benefit to 1 people. Now you will ask that how can we give benefit to 2.5 people? Either we will give drug to 2 or 3, and you are correct. But NNT is calculated for a large population. So if you want to give benefit to 1, you need to give it to 2.5. But generally we do not want to give benefit only to 1 patient. Suppose I want to give benefit to 2 patients, then I will give this new drug to 5 people, like that. Okay? So this is number needed to treat, how many patients you need to treat to give advantage to 1 people. And how it is calculated? This is calculated by 1 by ARR. What is ARR? Absolute risk reduction, which is defined as incidence in placebo minus incidence in treatment group. Okay? And we will divide it by 1. So we will get the answer 50 by 20 or 2.5. I hope it is clear. Now the next question is, I hope how number needed to treat is clear in this example, and it will be equal to 20 by 50 will come out above, so it will be 50 by 20, or you can solve 20 by 50 also and you can then get an NT also, like 20 by 50, 1 by 2.5 is the answer. It's okay, I have done it right. Next question is, from Avinash, lower limit of normal range in a growth chart curve is 80% of median weight, 60% of median weight, 70%, 50% of median. Lower limit of normal range in a growth chart curve. Lower limit of normal range in a growth chart curve. This is a growth chart curve. Okay. Lower limit of the normal range in a growth chart curve. Answer will definitely be 50% of median weight. Because why it is 50% median weight? Because it is a normal range in a growth chart curve. Okay. Let me, because this is a new question even for me, so let me do it. Normal range, lower limit lower limit of the normal range in growth chart curve. Okay, growth chart, lower limit of the normal range in growth chart. So in a growth chart, we know that there are three curves which are formed. Okay, this curve is at 50 percentile. Okay, this curve is at -2 standard deviation, and this plot is at -3 standard deviation. 50 percentile is the upper limit, and therefore 50% is not the answer, because here they are asking lower limit, they are not asking the upper limit. So they are asking, where does this limit lie? How many people are above that? What is the point where you get this point? Now, this is one way of representing a curve, a growth chart, or representing a population. The second way of representing a growth curve is when you plot it like this. In this, we know that between -2 standard deviation and +2 standard deviation, how many value lie? If it is a standard normal curve, between -2 and +2, 95% value lie. And now we know this now, -2 +2, 95%. That means how many value are below -2? If you subtract 95 from 100, what you will get? 5. 100 minus 95, you will get 5. That 5 will not be on one side, that 5 will be on both the sides. So 2.5% here, 2.5% here. Okay, so this lower limit of normal range, this part is the normal range, this part is the normal range, and the lower limit, this is the lower limit of normal range. Lower limit is at -2 standard deviation. And how many people are below -2 standard deviation? We can see it from the curve that 2.5% people are below -2 standard deviation, are below -2 standard deviation. How many people are there? 2.5%. So below -2, below it 2.5% are there. So if 2.5% are below there, how many are above that? How many are above that? Above 2.5 there is 95 and plus this 2.5. So 2.5% plus 95%, total 97.5% are above it, above the lower limit. Okay now? Because below -2, 2.5% lie, and above -2, 97.5 lie, because 2.5% are below it. So out of 100, if you remove 2.5, how many are above it? 97.5% are above it. Okay, so where is the lower limit of normal range? Lower limit of normal range is at 97.5%. Okay, at 97.5% you have lower limit of normal range. But in the question this is 97% of all value, but the option that they have given is in terms of median weight. It is 80% of median weight, 60% of median weight, 70% of median weight, or 50% of median weight. So 50% of median weight is the upper limit. Okay, and 97.5% of median weight is the lower limit. So I think the correct answer will be 97.5% of median weight is the point where you will find the lower limit. So lower limit will be present at 97.5, but it is not in the option. Okay, so because it is not in the option, it means either I am not understanding what the question is asking, or in the question the language is or the question is, let's say, not complete or something, because it is not in the option. Okay, 80% of median weight, 60%. I am stuck here. Okay, it's rare, but I am stuck. Anna. Yes, 2.5% are below it, below lower limit. But they have not asked how many are below lower limit. They have asked, the question have asked, lower limit of the normal range in growth chart, where does it lie? So it lie either 97.5% or at 2.5%. Either 97.5 or 2.5% should be in the option according to it. But that is not in the option. So I will go through this question once more, and because we have one more day, 23rd, so on 23rd I will discuss these two things. One, this question, and other is the COVID-19 death certificate thing. Okay, because my question is not necessarily wrong question, maybe I am wrong, because anyone can do mistake, even I can do mistake. There is no one is perfect in, so there can be wrong. I can be the one who is doing it wrong, but I will confirm it, and next time I will make it that on 23rd I will answer this question again. Okay. Okay. Next thing, one question is from Sagar. Is that okay. Next question is that whether NNT is related to efficacy. The answer is yes. Why? What is efficacy? What is NNT? Efficacy is actually the effect of drug according to the dose in a controlled environment. Efficacy is effect of drug in a controlled environment. Controlled environment means when you are doing a RCT, randomized controlled trial, you are observing the participant and you have kept the RCT participant under your observation. So it is a controlled environment because everything is under your control. In that case, what is the effect of drug? Suppose you have given this drug in 100 people to protect from myocardial infarction or to protect from migraine. So out of 100 people, how many are protected by migraine if we give this drug in a controlled environment? That is efficacy. And NNT simply means how many patients need to be treated if you need to give advantage to one patient. So NNT means how many patients need to be treated to give advantage to one patient. How many patients need to be treated to give advantage to one patient. Okay. And here you are finding efficacy, which is again almost the same thing, that out of 100, how many will be protected from migraine if you give the drug under a controlled environment. So in a controlled environment, if you give the drug and let's say 20 people are protected out of 100, so 20 out of 100 will be the efficacy. Okay. So here patient got treated out of total in an RCT. Okay, that will be the efficacy of the drug. Okay. Okay, so that's one of the question. One more question was from PS Krishna. that what is the random sampling distribution of means? Very good question. Random sampling distribution of mean. See, from a population, let me take one fresh slide. From a population, we can take many small sample. Okay. For example, let's say if there is 15 students in a class, and I want to know that how many out of these 15 students, let's say I want to know how many alcohol they consume in a week. Okay, so this is 15 student population. Okay, from this 15 student population, I took sample, and from the population I can took sample. So out of the 15, I took any 3 student, sample 1 of 3 student, and I ask them that okay, how much alcohol do you consume in a week? And suppose they said that we consume, let's say 50 to 150 ml per week, very less consumption. Okay, but a good one, and you should have less consumption. That's a good thing to do. And of course, now you have sample 2 again of 3 student, and you again ask how much alcohol do you consume, and they said that we consume around, let's say 100 to 200 ml per week. Okay, then we have a sample 3, sample 4 and sample 5. We can take 5 sample out of 15 because each sample have 3 students. So out of 15 we can take 5 sample of 3 student, sample 2 of 3 student, sample 3 of 3 student, है ना? Always we have 3 student in each sample. So in third, suppose the answer they gave is, let's say from 150 to 250, and then third they said from 250 no 100 to 200, then ठीक है 150 to 250, then they said let's say 250 to 350, and suppose the fourth they said from 350 to okay, let me make it better, 150 to 250, okay, 250 to 350, 350 to 450, 450 to 550. Suppose the 5 group have given this 5 answer. So each of this group is a sample, and from each of the group I can get some mean. The mean of first sample in this case will be 100. The mean of second case, here the mean will be equal to 200. Here the mean will be equal to 300. Here the mean will be equal to 400. And here the mean will be equal to 500. So these are the 5 mean which we can get from the 5 sample, and this is the whole population. So if you plot this curve of 15 student, we will get a curve something like this, in which the average of all the 5 sample, what will be the mean of 500, 400, 300, 200 and 100? What will be the mean? Of course, the mean will be 300, because the average of 1, 2, 3, 4, 5 is 3. So the mean is 300, and the remaining population, it ranges from 50 to, let's say, 550 it is ranging, and the range is big, but 300 is the mean of the whole population. So this 300 is the population mean. This is the population mean, the mean of the total 15 student, and All of these different things are the sample mean. These are the sample mean. These are the sample mean. Sample mean of first, second, third, fourth and fifth, and this is also sample mean. Sample mean of third sample, and this is equal to the population mean, but it is sample mean also, na? Sample mean of third, fourth and fifth sample. So here क्या हुआ, ये बंद हो गया तो घूम ही रहा है, क्या हुआ, बंद हो गया क्या क्लास? क्या करना है भाई क्लास का? बोल भी नहीं रहा है मेरे भाई, कुछ तो बोलो। मेरे भाई क्या हुआ, क्लास तो रुक गया ना, नेट तब से बोल रहा था। हाँ देखो ना, अपलोड वहां पे रुक गया, आ जाओ, देखो भाई आ जाओ ऋषभ, बट वहां पे तो अपलोड, यहाँ पे ऑफलाइन दिखा रहा है ना। क्लास चल रहा है, यहाँ पे तो ऑफलाइन दिखा रहा था। डिस्टर्बेंस, sorry for the disturbance, I thought that it was offline, so I stopped. The question was that he wanted to know about random sampling distribution of mean. So out of 15 I have chosen 5 sample, and I have chosen those 5 sample randomly, and these are the mean of 5 sample: 100, 200, 300, 400, 500. So random sampling distribution of mean means how these mean are distributed, how the mean of random sample are present. So you can see that the mean of random sample are present something like this. Here we have the 100, then we have the 200, then 300, then 400, then 500. This is how the mean from a random sample are distributed. So random distribution of sample mean is always in a bell-shaped curve. Bell-shaped curve or normal curve. Whenever you took large number of sample from a population, for example, in my example, I have taken 5 sample from a population of 15 people. So those 5 sample, if they are taken randomly, they distribute in such a way that when we draw the curve, it became a normal curve. Okay, like in our example, 100, 200, 300, 400, 500, these are the means of various sample, and they were distributed in such a way that they form uniform shaped curve, normal bell shaped curve. So random distribution of sample mean, what does it mean? It means that when you take a small sample from a large population, how is their mean distributed? And usually when you arrange the mean distribution, it gives you normal shaped curve. The second point which we can get from this random distribution of sample mean is that what is standard error? Standard error is defined as the average distance of each sample mean, okay, taken randomly so it is each sample mean from population mean. Okay, the average distance of each sample mean from population mean is known as standard error. So in our example, the 5 sample mean were 100, 200, 300, 400, 500, and this 300 was the population mean. So standard error means how far are this sample mean which are taken randomly, how far is each sample mean from the population mean, what is the average distance of each of the sample mean from the population means 300. So the average distance of each of the sample mean from the population mean we can find out with the formula of standard deviation by under root of sample size. Okay, so what is the difference between standard deviation and standard error? Whenever we calculate a standard deviation, we calculate it only for a sample, and whenever we calculate a standard error, we calculate for a population. Okay, and if you ask what do you mean by random distribution of sample mean, so random distribution of sample mean means from a population of 15 people we can take 5 random sample, how they are distributed. This is what random distribution of sample mean. And usually if we take random sample and we see the arrangement of mean, we will find that they are distributed in a bell shaped curve. Okay, so random distribution of sample mean means that how the sample means are distributed, and usually they are distributed in a normal shaped curved or bell shaped curved. Okay, what is a standard error? A standard error is average distance of each sample mean from population mean. And what is a standard deviation? If you look at the definition of a standard deviation, it is average distance of each number from sample mean. Average distance of each number from sample mean. Okay, so suppose let's say the first sample was, in the first sample there were 3 students, first, second and third student. They answered, first answered 50 ml per week, second answered 100 ml per week, third student answered 150 ml per week. So each of these 50 and they all are away from the sample mean. 100 will be the mean of these 3 students, 100 will be the sample mean. So 50 to 100, that will be the standard deviation. Average distance of each number from the sample mean, that is a standard deviation. So when we talk only of the 3 students, then we can find out the standard deviation. But when we are talking about the whole population of 15 people, then we will use standard error. So standard error is calculated for a whole population. Standard deviation is calculated for a sample. Standard deviation is average distance of each number from sample mean, whereas standard error is average distance of each sample mean from population mean. Okay, and how is the mean of random samples are distributed? They are distributed they are distributed normally. Okay, so I hope this session is useful to you in solving some of your doubt. Please be ready with your doubt in the next session, just like you were ready in this class, and please keep asking your doubt. One of the question from Sagar was that NNT means 50% efficacy. No, no, no. NNT and efficacy, their meaning is same, that if NNT is high, then efficacy is low, because high NNT means that you need to treat more patient to give advantage to one person. So that means this drug has less efficacy. Efficacy means how many people are protected by giving this new drug. So suppose 5 people are protected out of 100 by new drug. So this will be the efficacy, 5 people out of 100. But if you find out NNT, how many are protected by new drug? So 5 people out of 100. That means if you want to give benefit to 1 people, 5 out of 100. So 1 out of 20, because 100 by 5 means 20. So 5 out of 100. So 1 out of 20. That means number needed to treat will be 1 out of 20. That means 1 out of 20 means 5, 1 out of 20. 1 out of 20 means 5 out of 100. You can say 1 out of 20 means 0.05. So NNT is equal to 1 out of 20, that is equal to 0.05. And so the NNT will be equal to 0.05 and efficacy will be 5 out of 100. So you can say it is again, so the NNT and efficacy, they are related, but their meaning is same, and it is not that NNT is equal to half of efficacy. If I say 5 people are protected out of 100 by new drug, the efficacy is 5 out of 100. And if I say that 5 out of 100 are protected by new drug, then the NNT means 5 is protected out of 100. That means 1 is protected out of 20. So the NNT will be 0.05. Okay. So here you can say 5 out of 100 is 0.05%. So efficacy will be in the percentage and number needed to treat will be in the decimal form. That will be the difference. Okay. So let's end the class over here. Please be ready with your question in the next session. Hope this session was useful, and I will discuss those 2 questions definitely the first thing in the next class. And before 23, I will also upload the video on dengue and Monica project. Okay. So thank you very much for listening this session. If you have any doubt, any question, feel free to ask it on my email ID or question, or you can ask it in the next session, which will be on 23rd, probably from the same time, 7 p.m. Okay. So thank you very much for listening. Hasta la vista. Das vidania. Bye bye. Bye bye.